CoughWatchSA is a digital participatory surveillance platform, which is a type of surveillance system that requires members of the community or the broader population to participate by sharing information or data on symptoms that are related to respiratory illnesses such as influenza, COVID-19, and respiratory syncytial virus. There are 3 types of surveys on the platform. The first one is linked to the enrollment process, where participants will have to go through a participant information sheet. And the second type of question on the platform is what we call the follow-up weekly symptoms questionnaire, which is sent to participants on a weekly basis. This will basically ask participants if they have encountered any symptoms related to respiratory illnesses, and if so, a series of follow-up questions are then asked that the participants will have to complete. The third and final aspect of the study is what we call the home-based testing, and this is when we link participants to a second pilot study where they can request for a driver to deliver a testing kit at the comfort of their homes, where they can collect a swab, and this can be tested at the laboratory. We do not have a systematic or routine way of collecting data on non-medically attended cases related to respiratory illnesses. Often when we quantify the burden of non-medically attended cases, we use health utilization surveys that are often administered once a year or in a study-specific context. So by having a platform such as CoughWatchSA, you are able to routinely and systematically on a weekly basis collect data on non-medically attended cases for respiratory illnesses. What we are hoping to achieve from the CoughWatchSA pilot is firstly to assess the feasibility of operationalizing a platform of this kind. Secondly, we want to be able to assess the acceptability, the uptake, as well as the perceptions and attitudes of participants in South Africa who engage in this platform. And thirdly, we want to be able to demonstrate the utility of having this platform in terms of its ability in tracking the signal of respiratory related illnesses by getting close to real-time data, which is what participants will be providing us. It allows us as a public health community to respond more timeously to potential clusters of cases that we might be identifying through the platform. We believe the early onset of the influenza season, when it is determined through the platform, could allow us to also plan accordingly for the management of cases during the seasonal influenza period. So there are a number of incentives that benefit both the public health community as well as individuals who will be participating in the platform. So there are several ways in which participants can access the platform. So one is through the NICD social media pages on Facebook, on Twitter, and LinkedIn, where participants will find a QR code that they can scan or a direct URL to the survey. On the NICD website as well, there is a section on CoughWatchSA which provides context into the study, as well as the same QR code and link that participants can access. What's also important to note is that the platform is zero-rated, which means that all participants will not incur any mobile data expenses.